implies the removal of the obstacles to health, that is to say, the elimination of malnutrition, ignorance, contaminated drinking water, and unhygienic housing, quite as much as it does the solution of purely medical problems such as lack of doctors, hospital beds, drugs, and vaccines. Now it is time to play the video of the speech of our delegate, Zara Shamim from USA.
Ladies and gentlemen, Assalamu alaikum. My name is Zara and I am a high school student from the greater Washington, D.C. area. I am honored and excited to be speaking to you all today. When tasked with writing a speech regarding the theme Health for All, the first thing that came to mind was the COVID-19 pandemic. Going through a pandemic of that extreme was a first-time experience for everyone, but the ways in which people combated the pandemic varied greatly due to many factors, most prominently geography and socioeconomic status. Those located in wealthy areas or countries had much easier access to vaccines than those living in poverty. According to the National Center for Biotechnology Information at the National Institute of Health, or the NIH, by the end of 2021, over 12 billion doses of the COVID-19 vaccine had been distributed globally. Organizations like the World Health Organization worked to provide equal vaccine opportunities for people all over the world. In fact, WHO Director General Dr. Tedros Adhanom Ghebreyesus states that the WHO is committed to, quote, serve all people of the world with equity, objectivity, and neutrality, end quote. However, the NIH has come to the conclusion that vaccine distribution on a worldwide scale is not equal. High-income countries were able to purchase vaccines before they were even produced. The US, for example, was able to purchase enough vaccine doses before vaccine production even began to immunize its entire population 3 times. In contrast, lower-income countries were unable to meet the minimum price for vaccines that was negotiated by higher-income countries. This barrier delayed the distribution of vaccines in lower-income countries and in turn resulted in more casualties. Vaccines were not the only resource difficult to come by in poor geographic areas. Healthcare workers in these countries struggled more than wealthy countries to find personal protective gear, such as respirators, eye protection, and more. Additionally, lower-income individuals were less likely to have the opportunity to work from home, and therefore faced job insecurity at a much higher rate than those who worked virtually. Honorable guests, after 3 years of living through the biggest crisis of our lives, the question is, how could these disparities have been avoided? And more importantly, how can we prevent them in the future? Thanks to the work of trusted researchers and scientists, we have seen the undeniable benefits of vaccination against COVID-19. But we must ensure that these benefits span across the whole world instead of being limited to wealthier nations. One way that we can work to equally distribute more vaccines across the world is by waiving the intellectual property protections, otherwise known as patents, earlier than we did with the COVID-19 pandemic. Had drug companies agreed to waive their patents earlier, the vaccine would have become more accessible much quicker than it actually did, since it would allow more developing countries to manufacture vaccines at a lower cost and distribute the doses faster within their regions. Wealthier countries should also avoid stockpiling vaccines beyond their needs, so that other countries can vaccinate their citizens. In addition to the inequalities on a global scale, misconceptions surrounding the vaccine and the disease itself can also be a hindrance to providing equitable healthcare during global crises as they did during the pandemic. Under the guidance and leadership of the WHO, countries across different economic spectrums can collaborate and share resources and information. To close, I would like to share a quote from Amina Mohammed, Deputy Secretary General of the United Nations, that I think goes hand in hand with the overarching theme of today's conference. Quote, "We are encouraged by the rollout of safe and effective vaccines, but the truth is simple. No person is safe until all, everyone, everywhere are safe. And no country is safe until all countries are safe. Only by working together can we ensure that no one is left behind. Only by working together can we recover better and build a world where everyone thrives in peace, dignity, and equality on a healthy planet. It is possible together." End quote. If we can work together to accomplish these goals, I believe that we will be one step closer to achieving health for all. Thank you so much for your time.
Now, I would like to play a short video clip, which is actually by Madam Fatma Munir Ahmed, MD and CEO of Hamdard Laboratories, Pakistan, regarding children's health and their problems.
इन नन्हे दिमागों को ग्रोथ के लिए मुकम्मल नींद चाहिए। अगर नींद ही पूरी नहीं होगी तो ख्वाब कैसे पूरे करेंगे? पाकिस्तान में 75% बच्चे बेवक्त सोने की आदत के बाइस नींद की कमी का शिकार हैं। समझिए, जानिए, अलामात पहचानिए। मजीद मालूमात के लिए नौनिहाल क्लिनिक से राब्ता करें। हमदर्द नौनिहाल, सेहतमंद अतफाल, मुस्तकबिल निहाल।
बच्चे कहाँ रुकते हैं, बस थक जाते हैं। पाकिस्तान में 5 साल तक की उम्र के 40% बच्चे ग़िज़ाई क़िल्लत की वजह से नशोनुमा की कमी का शिकार हैं। ग़िज़ाइयत की कमी नजर नहीं आती, बस रुकावट बन जाती है। समझिए, जानिए, अलामात पहचानिए। मज़ीद मालूमात के लिए नौनिहाल क्लिनिक से राब्ता करें। हमदर्द नौनिहाल, सेहतमंद अतफाल, मुस्तकबिल निहाल।
Dear delegates, now the question rises that what does health for all means? Health for all means that health should be regarded as an objective of economic development and not merely as one of the means of attaining it. It demands ultimately literacy for all. Until this becomes reality, it demands at least the beginning of an understanding of what health means for every individual. The next speaker we have Isha Ahmed Ali from Hamdard Village School. She will speak in Urdu. Hamdard Village School has been founded with the aim of providing the best possible education and training facilities to students. It has a strength of around 700 students from the surrounding area of Madinat al-Hikmah, including 38 villages. Hamdard Foundation Pakistan provides quality education, uniforms, school bags, and shoes to Hamdard Village School. Isha, please proceed.
जनाब सदर, मोहतरम असातिज़ा इकराम और मेरे साथियों, अस्सलामु अलैकुम। आज इस आलमी यौम सेहत के मौके पर जो मौजू ज़ेर बहस है वो है सेहत सबके लिए। जनाब सदर, जिस्मानी और ज़हनी सेहत हर इंसान के लिए कीमती मता है। अगर सेहत और तंदुरुस्ती नहीं है तो यकीनन इंसान कोई काम भी उसने खूबी के साथ अंजाम नहीं दे सकता। अगर सेहत जिस्मानी हो या ज़हनी, तारीख के हर दौर में से बुनियादी अहमियत तो ऐसी हासिल रही है। सेहत और सेहतमंदी के लिए इंसान ने हर दौर में बहुत कोशिशें की है, जो मिसालें बनती जा रही है। सेहत और सेहतमंदी की अहमियत और ज़रूरत के बारे में नक्ता फ़िक्र में शुरू से आज तक कोई तब्दीली नहीं हुई है। सेहत एक अजीम नेमत है जिसका कोई बदल नहीं। सेमोज़र के कितने ही ढेर क्यों ना लगे हो, अगर सेहत ना हो तो इनकी हैसियत कुछ भी नहीं। जनाब आली, इस्लाम सबसे पहला मजहब और पहला ज़ाब्ता हयात है जिसने सेहत और सफाई को लाजिम मलजूम करार दिया और सेहत और सफाई के रिश्ते को मजबूत किया। इस बात से किसी तरह इनकार नहीं किया जा सकता कि दूसरे मज़ाहिब में भी सफाई व पाकीज़गी का ख्याल था, मगर वहाँ इसकी हैसियत उमूमी और सानवी थी। इस्लाम ने सबसे मुमताज़ होकर हिफ्ज़ व सेहत और तहारत के उसूल को हम मायने मफ़हूम कर दिया। अकाइक सेहत की फहरिस्त में एतदाल में आना रवि की अहमियत नाकाबिले तरदीद है। इस सिलसिले में रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम ने वज़ाह ऐलान फरमा दिया कि राह एतदाल में ही सलामती है। मुअज़्ज़िज़ सामीन, जिंदगी के तमाम मामूलात और मामलात में एतदाल में आना रवि हासिल करके हर बशर सेहत हासिल कर सकता है। एतदाल में खाना, एतदाल में सोना, एतदाल में जागना, एतदाल में वर्जिश करना और भी बहुत से मामलात में एतदाल हमारी जिंदगी की जामिन है। इस्लाम के ज़री उसूल को पूरी दुनिया ने 1000 बरस बाद तस्लीम किया। तमाम इंसान इस्लाम के उसूलों के मुताबिक अगर जिंदगी गुजारे तो हम बड़े हद तक बीमारियों से बच सकते हैं। इसके अलावा इलाज मालिज की सहूलतों पर भी सबका बराबर हक होना चाहिए। ये नहीं कि जिसके पास वसाइल हो बेहतरीन इलाज का हकदार भी वही हो। जनाब सदर, अल्लाह ने हमारी जमीन में इंसान की आसाइशों के लिए बेशुमार खजाने छुपा रखे हैं, लेकिन हर गुजरते दिन के साथ हमारी फिजा आलूदा होती जा रही है और इन आलूदगियों की वजह से इंसान बेशुमार खतरनाक बीमारियों में मुब्तला हो रहा है और इसकी सेहत गिरती जा रही है। इस महंगाई के दौर में बेहतरीन इलाज हासिल करना बज़ादत खुद एक मुश्किल मरहला है। इसके लिए तमाम अस्पतालों का एक ही मंशूर होना चाहिए, इलाज सेहत सबके लिए, और इस पर सख्ती से अमल पैरा भी होना चाहिए। जनाब सदर, मजहब इस्लाम में अमराज इंसान का मदावा इसकी तालीमात का जुज है। इसलिए आज आलमी यौम सेहत के मौके पर आलमी इदारा सेहत ने पूरी दुनिया की तवज्जो अमली इक़दाम की जानिब मबज़ूल कराई है, ताकि हर इंसान को सेहतमंद और हर फिजा को हर किस्म की आलूदगी से पाक रखा जाए। आज हकीम मोहम्मद सईद शहीद जैसे अफराद की बड़ी जरूरत है, जो कौल से ज्यादा फेल पर तवज्जो दे, ऐसे तदाबीर इख्तियार करे जिनसे सेहत सबके लिए का फरोग हो, मौसमी तब्दीलियों के असरात भी कम हो। तहफ़्फ़ुज़ सेहत काविशों की तजदीद करे, सेहत की तहफ़्फ़ुज़ के रास्ते तलाश करे, मुख्तलिफ अमराज और मुज़िर सेहत आदात को रोकने के लिए हर सतह पर प्रोग्राम मुनक्किद कराए जाए, ताकि इससे आगाही हासिल हो सके। शुक्रिया।
Thank you. It is time to welcome our delegate Sabah Noor from Warsak Model School and College, Peshawar.
The most merciful and the most beneficent. I am Sabah Noor from grade 9th, representing Warsak Model School and College, Peshawar. I would like to start my speech with a beautiful quote. Health is a complete harmony of body, mind, and spirit. Honorable President, I am honored today to talk about a goal that we all share. Health for all. This is not just a slogan, but a vision that has been driving the efforts of global health organizations for decades. It is a fundamental right of every individual to access the highest possible level of health without any discrimination, regardless of their socioeconomic status, gender, race, or nationality. From the COVID-19 pandemic to the growing burden of non-communicable diseases, these challenges require a concerted efforts from all the stakeholders to achieve health for all. It requires a shift towards more comprehensive approach that prioritizes health prevention, disease prevention, and early detection. Honorable President, the first step towards achieving health for all is to invest in healthcare systems and facilities. It includes access to essential medicines, vaccines, and basic healthcare services. It also means strengthening healthcare systems and building capacity, particularly in low-income countries, to ensure that everyone has access to quality healthcare services. Secondly, we must prioritize preventive and advanced healthcare strategies that address the underlying determinants of health. This means addressing factors such as poverty, social exclusion, and discrimination, which contribute significantly to the poor health outcomes. This means particularly among vulnerable populations such as women, children, and refugees. Thirdly, achieving health for all requires collaboration and cooperation between different sectors and stakeholders. The Honorable President, finally, achieving health for all is not just a matter of health, but a matter of social justice. It is a fundamental human right of every individual that should be available to all, regardless of their background or circumstances. In conclusion, achieving health for all is a shared responsibility that requires the collective effort from all the stakeholders. Let us work together and create a world where health is not a privilege but a right for all. Thank you.